Addiction has its grip on this country, infiltrating urban centers to even tightly knit small towns across the nation. We often hear about those who grapple with addiction or die after overdose, but rarely about the scores of American families left behind. More than 320,000 children have lost a parent to a drug overdose in just the last decade. And this leaves a trail of trauma for those children as they grow. And the mental health impact is something professionals are just beginning to address. We do want to welcome in Kathleen Strain now, a volunteer coordinator at To End Addiction. Kathleen, I really appreciate you joining us on this important topic, and I think we haven't heard about these 320,000 children who've experienced this loss, this trauma. Are we raising an entire generation of kids impacted by addiction?
We are. Unfortunately, the children are oftentimes overlooked. We now know, preliminary estimates and best guesses are telling us that there's about 320,000 children just in the last 10 years. But we know that number goes far above that, right? Not even just missing plenty of kids that have lost a parent to an overdose, but also the children that are living with the trauma because of, active addiction, or maybe their parents' incarceration, or maybe their parent is away at treatment. So there's all kinds of loss that these children are feeling, not just the death. So I want to make sure to recognize that in those families as well.
That's such an important thing to point out. There are many ways to lose having an active parent in your life. And talk me through some of the consequences here for these children, short and long term.
Sure. There's not enough mental health resources. The resources specifically for children that are impacted by their substance use, their parents' substance use, are really non-existent. Our schools are overwhelmed. There's kids in probably every classroom in America that have a child, that have a parent living with addiction. So those resources are just really not existent for these kids. And we know that addiction is genetic, right? So the chances of these children with the trauma that they're living with, and also that they have that genetic component of addiction, their chances could be higher to have addiction themselves. So really prevention needs to really start sooner than, we're doing a really poor job with prevention, especially for these children.
Okay, so tell me more about that, because that was going to be my next question. Are these children more or less likely to grapple with addiction themselves in the future? And you say a combination of potentially genetic factors and also what they've been exposed to, and coping with the trauma of what they've been exposed to actually puts them at a higher risk. So what do we need to do, and at what age does this intervention need to take place?
Really, intervention starts early, even in the womb, if you think about it, right? If we have moms that are living with addiction, when they become pregnant, making sure those supports are in place for the mother and the child that will soon be here is so critical. And we really lack with those support services as well. Oftentimes, women need to choose between receiving treatment or caring for their kids. They have to give their kids to up to children and youth, and have a certain set amount of time to recover. We know addiction doesn't work that way. And we also know that trauma is the root cause for addiction. So just having more supports in place, funneling money. We have all of these dollars coming in from opioid settlement dollars, and the areas that continuously are overlooked are pregnant and postpartum women and children that are dealing with the consequences of their parents' substance use.
And it's interesting. I mean, I think thinking back to my own education, most of the messaging in education around drugs and prevention was in high school, maybe a little bit in middle school. Is that too late for American children today?
It is too late. Kids are being exposed to things so much sooner, elementary school, especially in we have so many states that have legalized marijuana or cannabis, or medical cannabis has been legalized in so many, areas. Children are seeing and hearing about these things much sooner, and with online platforms, they're learning this information really much quicker than we did. It's a whole new generation that we're not prepared for.
Okay, we really appreciate you joining us on this. It's really food for thought and something I think many more people need to become aware of. Kathleen Strain, I appreciate your work. I appreciate your time. Thank you.
Thank you for watching. Go to newsnationnow.com to find News Nation on your television provider. And don't forget to click the red subscribe button below to get more of News Nation's fact-driven, unbiased coverage.